What is tummy tuck? See, everybody after pregnancy, they go through a lot of changes in the body. Breast started sagging, tummy skin become loose, and the muscles supposed to be in the midline like this will deviate and go to the sides because of the push of the baby. So because of these changes, what happens is your tummy looks big all the time. Though you do diet and exercise every day and you don't want to look your tummy to look bigger, but whatever exercise you do, whatever diet you follow, tummy won't shrink. The reason is not because of the fat, it's because of your abdominal muscle weakness as well as the diastasis recti. We say the center of the muscle deviation, it's called diastasis recti. Because of that, you will have constantly the bigger belly. So people keep asking you whether you're pregnant or not, even if you're not pregnant. So that really disturbs you. It psychologically affects you so much and you don't know how to manage it. So obviously you need a plastic surgeon's help. In foreign countries, it's not a very uncommon thing. Every alternate person should have undergone a tummy tuck procedure. That's very common there. But here in India and countries surrounding the India, people are not aware that there is a solution for this. That itself is the biggest problem in our country. So this is the surgery only. Obviously, by non-surgical means, you can't correct this thing. Meaning, you do diet and exercise or you do muscle strengthening exercise, nothing will happen. This is not going to be corrected by your own methods. Even non-surgically doing a radio frequency based machines and all other things will make it a little better, but definitely the results in your mind cannot be achieved by doing non-surgical measures. So only surgery is the treatment. So how to go about? So first you have to understand your body has to be fit for this surgery. This is little major surgery, yes. Obviously around 3 to 4 hours the surgery time going to be, and your hemoglobin has to be above 10 grams. So ideal will be around 12 grams. You need not give the blood during surgery. So keep the hemoglobin around 12. If it is not 12, you take a lot of the iron infusions and iron tablets according to the doctor's advice and follow it and make the hemoglobin come to around 12. Another if you have blood sugar or hypertension, control it. It has to be under strict normal values, then only we can plan for the surgery. And if you have a huge tummy, we need to push the whole content inside. So what we advise is before surgery itself, we ask you to do a lot of breathing exercises. Exercise has to be planned even a month prior or a week prior to the surgery. So the lungs will resist the pressure from the tummy. Otherwise, what happens when you tighten the whole tummy, the whole content will go and press the lung above. So you will end up in a complication. So you need to do these kind of exercises before surgery. Other instructions what we give before surgery is you have to few tablets to heal your wound faster after surgery. So what are the tablets? Vitamin C we ask you to take a week prior, and arnica, there is a homeopathy medicine given by the homeopathy doctors that will reduce the swelling post surgery, and some skin tightening medications that also we ask you to take even before surgery. If you are not taking these things, nothing to worry. After surgery, you can take these medications for 45 days. And I always advise patients to come a day prior to the surgery for consultation. The patients are coming from other cities or other countries. So one day prior, you come for a consultation and make yourself familiarized with this environment and staffs and finish the formalities even the day prior, like filling the forms and consent forms, all those things you properly read and go through it and sign it the day prior. And next day morning you come for a surgery and we'll do marking, and then we'll take the photograph of the involved area and we'll shift you to the theater. There we'll do it under general anesthesia only. So general anesthesia will be comfortable to you, and so that we always give a general anesthesia. You sleep, when you get up, surgery will be over. The cuts going to be the cut below your panty. We plan it earlier itself, before surgery itself, where to give the incision. So when you are wearing a panty, the scar should not be visible. That's our aim. So we raise the whole tummy skin. We do liposuction first. Sometimes the back of the tummy, also the side of the tummy, the lower back will have a lot of fat deposits. So we remove that as well as remove the fat in the tummy region. Then we make the cut. We raise the whole skin flap. We detach the navel. So navel will be left inside, and we lift the whole tummy skin. We tighten the midline, the deviated muscle nicely, so that you get the nice muscle strength back. And then we relocate the navel and pull the navel through the skin. All the excess skin will be removed and tighten so much. Basically, we put your head up and bend your knee, and then we stitch it in tighter manner, so that I don't want any loose skin issue after surgery. So we do it in a tight way so that results will be very good. And we try to create the packs like midline groove and two packs and the nice curves in the sides. All those things we try to achieve during surgery. And we do something called quilting stitches so that you won't get the seromas after surgery. Normally we keep a drain maximum for 24 hours. Sometimes even we don't even keep a drain, but 24 hours drain will be there in most of my cases. And we remove the drainage tube. Drainage tube means the tube will be inside the operated area to collect the excess fluid and the blood coming out in that area. So we keep the drainage tube for 24 hours and we remove the drainage tube after 24 hours. So after surgery, we'll give a lot of the surgical blocks in the operated area, meaning to avoid the pain in that area, we give a lot of local anesthesia during surgery itself. So you don't feel the pain for at least 5-6 hours after surgery. So after surgery, we'll give a lot of painkillers, the other antibiotic and other medicines, so that you will recover faster. So that day night, we'll give a very strong painkiller like a morphine. So you will sleep well in the night, you will get up in the morning. But after surgery, 4 hours after surgery, we'll make you walk and go to the restroom and come back and do little movements, because there is a complication called deep vein thrombosis which happens in the longer surgeries. So this surgery happens almost 3 to 4 hours. So we need to keep moving your limbs often after surgery, and you have to walk immediately after surgery. So that will prevent this complication. So we make you walk on the 4th hour after surgery. And next day morning, once the drain removed, maybe the day evening, second day evening, you'll be discharged home. So we'll be removing the dressing, and we'll put water resistant plasters so that you won't avoid water. Basically, you can take shower and you can wash your body regularly. There won't be any restrictions for you from the second day onwards. But you need to bend and walk for at least for a few days, maybe 4-5 days. You have to bend and walk, because we pulled and stitch it, so that there'll be a strain. I don't want to have a strain in the suture line. So little bending will help you to heal the wound faster. And you'll be given a tight fitting dressing kind of thing that you need to wear it 24/7 for almost for 2 months. So you come back after 7 days. If you are in Chennai, I ask you to come on 5th day and 7th day. Sometimes the fluid collection might be there. We need to put a needle to aspirate. So that you need to come on 5th and 7th day for the regular visits. And 7th day we remove the navel stitches, and that lower stitches will be always absorbable, so you do not remove it. So you can go back to your native place on 8th or 9th day. But if you're other country, I want you to stay here at least for 12 days to 15 days, so that I don't want you to take any kind of a little risk after going there. So common problems are the seroma collection, you need to go for a few aspirations, and sometimes wound healing issues. So all those things we tackle when you're here, and we'll send you back safely. So the restrictions wise, so you can do a normal housework after 10 days, but office goers can go from 15th day onwards for the work. It will be a little difficult, but you can manage and go for the work. The complete healing, at least 2.5 to 3 months it happens. So doing heavy workouts, swimming, all those things, at least you need to wait for 3 months. And little manual workers, probably after a month they can go back for the work. So these are all the restrictions after surgery. And the swelling takes at least easily 2 to 2.5 months to come down, complete swelling reduction. So you can start doing the walking and all from a month onwards, and end of 2 months you can start doing a jogging and slow jogging, and slowly increases the exercise intensity and progress further. I think I clear most of your queries about the tummy tuck. This tummy tuck, one more thing is you have to complete your family before planning for the tummy tuck. Meaning, so if you want to have 2 kids, finish 2 kids, then come for the surgery. Can't go for the pregnancies after tummy tuck. What happens, you pull the whole tummy skin down, excess skin we removed and tighten it so much. When the pregnancy happens, the tummy skin again stretches. Sometimes the wound will go for a wound gaping, wound tenderness, and immediately you have to go for an early cesarean. These kind of issues will happen post tummy tuck pregnancies. So unless otherwise you haven't finished your family, don't plan for the tummy tuck. Wait till you finish your family, then come to us for the tummy tuck. And always tummy tuck has to be done when you are almost ideal weight. So try to lose weight as much as possible and come. Then only you can get a very good results than coming in between. So all those things you have to understand. So definitely you'll have some more queries. My mobile number is below this video. So you can contact me in WhatsApp, or you can ask for a video consultation. Clear your complete queries before planning for the procedure. Thank you.